नमस्कार। फैमिल के सारे दर्शकों को हमारा एक बार फिर नमस्कार। आशा करते हैं आप सब सुरक्षित और सेहतमंद हैं। While we are relieved and the number of COVID infections have reduced, we are still not totally free. Just recently, Famhealth and Scope, the Standing Conference of Public Enterprise, which is an apex professional organization representing the central government of public enterprise, came together to organize self-help workshops for its management and employees. The person behind the collaboration is none other than Mr. Atul Sopti, who is the Director General of Scope. Mr. Sopti is not just a visionary leader with the professional experience of nearly 4 decades, but before leading Scope as Director General, he was the Chairman and Managing Director of BHEL, a Maharatna public enterprise. He is also the Fellow of the Indian National Academy of Engineering and the Institution of Engineering and a member of the World Energy Council. He is very keen on the cause of mental health. The workshops, which were conducted with very senior medical experts from the industry, covered a holistic approach on mental health and physical health with context to COVID-19. Today, on this very special show, we are delighted to speak to Mr. Atul Sopti on what the government organization like Scope is doing with COVID and what was the thought behind these workshops. Welcome to the show, Mr. Sopti.
Thank you, Rishali.
We are delighted and we have worked so closely with you, Mr. Sopti. If you can tell our viewers, we've been hearing that Scope and other public sector organizations have taken a lot of care of its personnel during these tough times. Do share with us some of the things that you have been doing.
तो मैं ये बताना चाहूंगा कि पहले तो स्टैंडिंग कॉन्फ्रेंस ऑफ पब्लिक एंटरप्राइजेज, जैसा आपने बोला, पब्लिक सेक्टर एंटरप्राइजेज की एपेक्स बॉडी होने के नाते हम इनकी ग्रोथ और एक्सीलेंस में योगदान के लिए कमिटेड हैं और कार्यरत हैं कैपेसिटी बिल्डिंग, कैपेसिटी एनहांसमेंट और पॉलिसी एडवोकेसी के द्वारा। और साथ साथ हमारा दायित्व ये भी है कि हम कैसे एक सशक्त समाज के निर्माण में अपना योगदान करें। आपने पूछा कि हम लोगों ने कोविड के दौरान क्या किया। कोविड की फर्स्ट वेव के दौरान जो है, ऑल ऑफ ए सडन when everybody was surprised because of the onset of COVID, public sector enterprise, they came forward. उन्होंने अपने इंफ्रास्ट्रक्चर को अवेलेबल कराया, कोविड हॉस्पिटल्स को अवेलेबल करवाया, मेडिकल इक्विपमेंट्स को अपने यहाँ बनाना शुरू किया, रिसर्च एंड डेवलपमेंट करा इस फील्ड में। जितने नीडी लोग थे, माइग्रेंट्स लोग थे, उन सबको जरूरतमंद की इसका सामान को प्रदान कराया। सब लोगों ने जुट के उस दौरान में बहुत बड़ा काम किया और हमने इनफैक्ट जो है इन सबको एक कंपेंडियम के रूप में इकट्ठा किया है और जिसको ऑनरेबल मिनिस्टर जावड़ेकर साहब ने रिलीज किया था सितंबर 2020 में, फर्स्ट वेव के दौरान। और इस कंपेंडियम में हमें जो है ब्लेसिंग्स मिली ऑनरेबल प्रेसिडेंट ऑफ इंडिया, ऑनरेबल वाइस प्रेसिडेंट ऑफ इंडिया, ऑनरेबल प्राइम मिनिस्टर ऑफ इंडिया एंड मैनी मिनिस्टर्स एंड सेक्रेटरीज। इसके बाद सेकेंड वेव आई। सेकेंड वेव में मेजॉरिटी ऑफ द वर्ल्ड वाज नॉट प्रिपेयर्ड फॉर इट। देयर आल्सो द पब्लिक सेक्टर एंटरप्राइज दे केम फॉरवर्ड। सबसे जरूरत थी ऑक्सीजन की। ऑक्सीजन के मुहैया कराने के लिए सारी हमारी कंपनीज फॉरवर्ड आई, क्योंकि हमारे कई प्रोडक्शन फैसिलिटीज के दौरान जो है ऑक्सीजन की जरूरत पड़ती है, ऑक्सीजन प्रोड्यूस होती है। तो उस ऑक्सीजन को डाइवर्ट किया गया हॉस्पिटल्स में, मेडिकल ऑक्सीजन के लिए ट्रांसपोर्ट करवाया गया ऑक्सीजन को। उसके अलावा फिर हम फॉरवर्ड आए अपनी इंफ्रास्ट्रक्चर को अवेलेबल कराने के लिए, लोगों को दवाइयां देने के लिए। और आपने देखा होगा कि सेकेंड कोविड के दौरान पूरे भारतवर्ष में किसी को भी पावर की दिक्कत नहीं आई है और मेजॉरिटी ऑफ द पावर हैज बीन सप्लाइड बाय द पब्लिक सेक्टर एंटरप्राइजेस। किसी को भी दिक्कत नहीं आई है पेट्रोलियम प्रोडक्ट्स की, किसी को भी किसी पावर प्लांट को दिक्कत नहीं आई है कोल प्रोडक्शन की, कहीं पर अनाज की कमी नहीं है। जिस भी फील्ड में पावर पब्लिक सेक्टर रहे हैं, कभी कोई परेशानी नहीं आई. They were the, I will say, the public sector employees who worked in the election. They were also the frontline warriors. काफी लोगों ने अपना जीवन अर्पित भी किया है, जिसके लिए हम अपनी ट्रिब्यूट पे करते हैं. एक पॉइंट बड़ा इंपॉर्टेंट है कि हेल्थ इज ए स्टेट ऑफ हार्मनी ऑफ द बॉडी एंड द माइंड. सो हमारा फोकस ना केवल फिजिकल वेलबींग पर रहा, पर मेंटल हेल्थ पर रहा, क्योंकि हमारा ये मानना है कि अगर मन और शरीर स्वस्थ है तो कोई भी इंसान जो है टफेस्ट पीरियड को भी पार कर सकता है. और ऑर्गेनाइजेशंस अपने देश के लिए एक, और एम्प्लॉइज के द्वारा जो है एक बहुत बड़ा कंट्रीब्यूशन कर सकती हैं. तो इस पर्सपेक्टिव के अंतर्गत जो है फैमहेल्थ और स्कोप ने मिलकर जो है पिछले 2 महीने के अंदर जो है बहुत महत्वपूर्ण इंटरेक्टिव प्रोग्राम आयोजित किए गए. पहला सेशन हमने जो है रिनाउंड साइकियाट्रिस्ट डॉक्टर निमेश देसाई के साथ आयोजित किया, जहां उन्होंने एक व्यक्ति के मेंटल हेल्थ को मजबूत करने की आवश्यकता पर और तरीके पर गाइड किया. बड़े ही सरल भाषा में उन्होंने गाइड किया. और प्रोग्राम का फॉर्मेट एक बहुत यूनिक था. इसमें 5 गेस्ट जो थे, they were brought on board live. That was very interesting format which we worked together. 5 guests were brought on board live to share their experiences of different nature to fight with the COVID and how they handled the most stressed days of their lives. और सुनाए गए जो एक्सपीरियंस है, मैं आपको बताना चाहूंगा, ना केवल इमोशनल थे, बल्कि उन वर्ड्स में भी हम टेंशन को महसूस कर रहे थे. Many of the people later on I came to know, including my own family, they were in tears at that point of time while listening to those experiences. एक ऐसा माहौल हुआ जिसमें ऐसा लगा कि अनुभवों को साझा करने के कारण जो है कि हम सब इस दुनिया में अकेले नहीं हैं, हम सब इकट्ठे हैं. तो इसीलिए इसका नाम भी दिया था हमने, शेयरिंग इज केयरिंग. और इस वार्तालाप के दौरान जो है डॉक्टर देसाई ने इन जो हमारे जो परेशान हमारे गेस्ट जो थे या डिस्ट्रेस गेस्ट थे, उनकी मदद की, उनको गाइड किया, बल्कि उनके माध्यम से एक बड़े ही इफेक्टिव संदेश दिए हम सबके लिए, जिसको हम अपने जीवन में इस्तेमाल कर सकते हैं और परेशानियों से बाहर आ सकते हैं. इसके बाद हमें लगा कि पेंडेमिक में काफी मिथ्स फैले हुए हैं सोसाइटी में, तो वी नीड टू हैव ए प्रोग्राम वेयर वी आइडेंटिफाई मिथ्स एंड रियलिटीज आउट ऑफ दैट. और उसके अलावा हमें कोविड रिलेटेड जितने भी एस्पेक्ट्स हैं, जितने पहलू हैं, इन पर विचार किया जाए. तो हमने सोचा कि इंटरेक्टिव सेशन ऑर्गेनाइज किया जाए. और इसके लिए हम जो है एक कंट्री के एक इंटरनेशनल रिनाउंड एक्सपर्ट्स कार्डियोलॉजिस्ट जो हैं डॉक्टर चोपड़ा, डॉक्टर एच के चोपड़ा, उनके साथ हमने इंटरेक्टिव सेशन का आयोजन किया गया, जहां पर पार्टिसिपेंट्स ने के कई सवालों का, कई कंसर्न्स का, कई चिंताओं का जवाब डॉक्टर चोपड़ा के द्वारा जो है बड़ी सरल भाषा में और स्पष्ट रूप से उन्होंने दिया. और उन्हें कई पहलुओं पे जोर मारा, जैसे ही टॉक्ड अबाउट ब्लैक फंगस, ही टॉक्ड अबाउट कोमॉर्बिडिटीज, ही टॉक्ड अबाउट वैक्सीनेशन, ही टॉक्ड अबाउट डूज एंड डोंट्स ऑफ सेल्फ मेडिकेशन, और एक नया कॉन्सेप्ट को शायद एक इंट्रोड्यूस किया, जो वर्ल्ड में पहला कॉन्सेप्ट है 3M कोविड प्रोटोकॉल्स, जो माइंडफुलनेस, मेडिकेशन एंड मेडिटेशन, इन सब की उन्होंने जानकारी दी। और दोनों ही सत्रों में, दोनों ही सेशंस में हजारों की तादाद में लोग जुड़े, हजारों की तादाद में लोग जुड़े, लाइव भी जुड़े, और उसके अलावा जो है स्कोप और फैम हेल्थ के हमारे जो सोशल मीडिया हैंडल्स हैं उसके द्वारा भी जुड़े। काफी ये सक्सेसफुल प्रोग्राम रहे, और मेरे को ये लगता है कि ये अभी एक शुरुआत है, ना केवल प्रेजेंट क्राइसिस को ओवरकम करने के लिए, बल्कि एक हेल्दी सेफ सोसाइटी को प्राप्त करने के लिए। दोनों प्रोग्राम्स के लिए, जैसे मैंने बोला, हमें बहुत ही पॉजिटिव रिस्पॉन्सेस मिले हैं इसके। जो लोग जो हैं, सबसे पहले तो बात करूंगा मेंटल हेल्थ की। देखिए, फिजिकल हेल्थ में तो आदमी ठीक हो जाता है, बट मेंटल हेल्थ के कॉन्सिक्वेंसेस या इम्पैक्ट काफी टाइम तक चलते हैं। तो हमने जो ये एक यूनिक प्लेटफॉर्म क्रिएट किया, जिसमें लोगों ने अपने एक्सपीरियंस शेयर किए, तो मेरे को काफी लोगों ने ये बताया, जब मैंने फीडबैक ली कि क्या आपको लगा इस प्रोग्राम के बारे में, तो उन्होंने बताया कि हम कहीं ना कहीं रिलेट कर सके कि हम भी इस तरीके से, हमने भी परेशानियों को झेला है। और जो हमारे गेस्ट थे, उन्होंने बताया कि इन्होंने कैसे इसको ओवरकम किया है। तो बहुत कॉन्फिडेंस लोगों में आया कि हाँ, हमें भी इससे बाहर निकलना है, क्योंकि लोग बाहर नहीं निकल पा रहे थे। ये एक बहुत बड़ा फायदा मिला। दूसरा जो है, अगर मैं मेंटल हेल्थ की बात करता हूं, तो उसमें कुछ हद तक जो है मेडिकेशन एस्पेक्ट्स को भी कवर किया गया था डॉक्टर देसाई ने, कि जरूरी नहीं है कि आप खुद ही कोशिश करते रहो। अगर आपको जरूरत है तो एक्सपर्ट्स के पास आपको जाना चाहिए। ये भी एक मिथ था लोगों के दिमाग में, नहीं कि मुझे साइकेट्रिस्ट के पास नहीं जाना है। और मैं आपको बताऊं कि मुझे उसके बाद कई बड़ी बड़ी ऑर्गेनाइजेशन ने अप्रोच किया कि हम अपने यहाँ एक सेंटर क्रिएट कर रहे हैं इस तरीके से, कि जहां पर जो है हमारे एम्प्लॉइज जो हैं एक्सपर्ट से बात कर सके। ये ये एक बहुत बड़ा फायदा हुआ है लोगों को, एक जानकारी मिलने से, अवेयरनेस होने से।
आई थिंक जैसे आपने कहा, ये बिगिनिंग है, एक स्टेप है इन द राइट डायरेक्शन। कोविड भी, जैसे अपने दर्शकों को जानते ही हैं, लेकिन दोबारा से याद दिला दें, खत्म नहीं हुआ ये लड़ाई, चल रही है अभी। सबने कोविड अप्रोप्रिएट बिहेवियर, जैसे डॉक्टर चोपड़ा हमें बता रहे थे हमारे शो में, बिल्कुल पूरी तरह 100% अपनाना है हमको सबको, बच्चों को, अपने फैमिली को, कॉलीग्स को। Each one of us has to be extremely careful, but at the same time घबराना नहीं है. I think that was one of the biggest learnings that came out of Dr. Chopra's interaction with us. And as Dr. Nimish Desai, he taught us, I think, the power of sharing. कितना vital है ये, कि अंदर ना रख के अगर आप अपने अपने जो दुख हैं, अपने अपने जो दर्द हैं, वो अगर शेयर करें तो कम हो सकता है काफ़ी हद तक, और काफ़ी हद तक किसी और का फ़ायदा जो सुन रहा है उसका हो सकता है. सो इट वाज फैंटास्टिक, एंड वी थैंक यू सो मच once again for being on this platform. आज इस सेंटिमेंट को आगे बढ़ाते हुए स्कोप और फैम हेल्थ ने इस स्पेशल सेशन का आयोजन किया है, शेयरिंग इज केयरिंग. Famhealth is an organization that follows the principle of today's theme. Sharing is actually caring. लेकिन sharing isn't one time. So Famhealth लगातार अपने support groups पे sharing sessions organize करता है. आज के सेशन को अंजाम देने के लिए और मेंटल हेल्थ जैसे टॉपिक को हमारे घर के भीतर लाने के लिए, हमारा हाथ पकड़ने के लिए हमारे साथ हैं रिनाउंड एक्सपर्ट डॉक्टर निमिश जी देसाई. Dr. Nimish Desai is an experienced psychiatrist in academic public service and a qualified public health professional, जिन्होंने अपने करियर में अनेक NGOs के साथ भी काम किया है। वे पिछले 10 साल से आईबाज दिल्ली के डायरेक्टर हैं और एडवाइजर के तौर पे इन्होंने पैंडेमिक के दौरान अनेक नेशनल एजेंसीज के साथ काम किया है। डॉक्टर निमिश जी देसाई।
2020 में we went through a lot of anxiety, some pain, some loss. There was universal concern, as I kept saying throughout the year, last year. But it was nowhere near what happened in the second wave in 2020. I don't need to underscore, but we'll just flag the fact that it will help us to remember that what we are going through right now in terms of psychological, emotional health, our well-being and subjective feeling is basically cumulative and collective. Is cumulative as much as in that since March, if not January 2020, we have been going through this series of ups and downs, and is collective as in terms of all of us, being together, and actually nobody being spared of the danger or the negative effects of the pandemic. Will there be a mental health epidemic? Are we on the brink of a mental health epidemic after the viral epidemic? During 2020, I genuinely believe, based on all the research that I have myself been part of in the last 25 years in disaster and epidemics in India and international and national evidence, that psychological distress, yes, but not psychiatry or mental health epidemic as such. And my colleagues, my friends in Famhealth team, Asha ji and Asha Kapoor and Vishali are familiar with this. But 2020, the second wave has changed that. Now there's a distinct possibility that there is already, or we are on the brink of a mental health epidemic. Will that be really hugely new psychiatric disorders or different? We will see in the course of the discussion today, and I think towards the end of the session. As I like to say, it's easier to say we are all in it together. We are not all in it together. As the diversity of experience of the 5 panelists today will reveal, we are not in the same boat. We are surely, possibly in the same storm, almost all of human race. But the boats are different, the experiences are different. And to that extent, it will help, like Rishali said, Famhealth belief has been, my individual conviction has been, and in our interactions with Dr. Opti and Scope executives, it's been very enlightening and satisfying that we all seem to agree about the value of sharing. The value of sharing for my own benefit and value of sharing for helping others, and most importantly, for the larger group. While it is very useful to realize that we are in the same situation, we are in it together, we are not in the same boat. So we need to again do that, find balancing of having empathy and compassion and caring for everyone else, for similar experiences, and yet be able to recognize how each one's experience has been different, and even people with similar experiences, because of various reasons, might feel and react very differently. And so that purpose, I do think, will be served by today's discussion very well.
We would like to throw it open to them to say that अगर आपके पास कोई भी सवाल है जो हम आज नहीं आंसर कर पाए, तो या तो स्कोप में लिखिए या हमारे प्लेटफॉर्म famhealth.in पे आइए, अपना सवाल छोड़िए, और डॉक्टर देसाई, very kind soul that he is, will definitely answer all your questions even after the session is over. So thank you once again, and let's begin first and foremost with our first sharer today, Ms. Renuka Verma ji. ये है जनरल मैनेजर ERP at HPCL. रेणुका जी ने अपने कोविड की जर्नी में खुद भी इस वायरस का शिकार रही हैं, और साथ ही उन्होंने अपने परिवार वालों को एक एम्पैथेटिक केयर गिवर के रूप में भी संभाला है. Let's hear from her. रेणुका जी.
Namaskar. Thank you, DG Scope and Dr. Desai, for giving me this platform to express my feelings and share my experience with everyone. My triest with COVID-19, it all started in mid of March, when I think it was yet to be named as second wave, I think. My direct associate was down with his entire family. I was now under quarantine, watching over my own health, and also my Arogya Setu, as it changed colors from green to yellow to amber to red. As one by one, several of my colleagues got affected. I was thanking my stars as days passed. Is baar mein baal bach gayi. But the fear was mounting inside me. It was in a matter of few days that the most dreaded happened. My spouse got up complaining of fever instead of me. His test was positive. I was in a state of shock. To be in face to face with the biggest of the fear that we were living with for the last 1 year, and more closely in last few days. Here it was, right inside my home. I felt so defeated. My fortress of sanitizers, masks, immunity boosters, the regime of healthy practices were all blown up. I was choking with emotions, disbelief, and uncertainty. I didn't know aaki kya hoga. It took me some time to absorb the facts, to acknowledge my feelings. It was the acceptance of it which actually gave me the strength. I knew deeply within my heart that I needed to cope with it. I needed to be rational. I turned to some of my close people for consultation and went on to do that what I was supposed to do. Take decisions for managing the medical protocol, hospitalizations, manage the recovery phase. The focus was all to do whatever is possible and the best that I could. But the ordeal was not to get over soon. I watched my loved ones getting sick one by one in quick succession. The toughest were my mom, who is a COPD, and my sister-in-law with kidney complications. I was experiencing multiple of emotions of fear of losing a loved one, anxiety to manage multiple medical needs, didn't want to regret later, so I just wanted to try out everything what was possible, of having to manage so many of them myself with helplessness, maintaining distance when they needed most of the love and care. I did breach it a couple of times. The guilt of being safe when all my loved ones were suffering. Entire day would be spent on phone trying to engage them into conversations, keep them motivated, consult doctors, and fulfill the care needs. At some point in time, there was one of my members on ventilator, one in ICU, one on oxygen support. 2 more were hospitalized, and 3 were under home care. It felt like I was in a field of mines, a minefield. One step in error, and I would also get consumed with all of them. Due to frequent hand wash and use of sanitizers, my hands were all full of rashes for weeks altogether. I don't know whether it was care or simple paranoia. There were bereavements in family, friends, but the grief, I didn't have time to recover from that. It was like being in a whirlpool of emotions. The more I would struggle to come out of it, there were more layers to negotiate. But I knew deep within, I had to cope. I had to bring myself to terms, regulate my emotions, that I could care for my people. They needed me the most now. I hung on to hope, to prayers. We are all part of nature, as Dr. Desai just pointed out. We will all heal as the nature heals itself. I realized that just an act of verbalizing our feelings with someone and sharing our feelings with each other can make us handle the crisis better. Having continuous conversations with my other family members, my spouse, it had had profound impact on the way I navigated my emotions. To reevaluate my approach towards being more grateful for the blessings that I had. I realized I was lucky to be spared, to be around my family so that I could care for them. I could get them the good medical care on time, the support system of my friends, colleagues, our respective organizations to fall back on. I'm eternally grateful to God to have them back at home. I continue my efforts to emotionally support people in crisis. My own way of reaching out to people. Hope is everything. It has given me the confidence to handle the negative thoughts and feelings. It has also helped me to be inspired and create positive vibes for the people around me, to increase the love, peace, joy for myself, my loved ones, and the world around me. I would like to sum up with a few borrowed lines. Everyone's losing something or someone. We have all got to play our part. Hang on to hope as we journey on, bruised, broken, but not losing heart. Thank you.
रेणुका जी, 5 पैनलिस्ट सभी हमें भावात्मक करके छोड़ेंगे, इसमें कोई सुबह नहीं है, लेकिन आप पहली पैनलिस्ट रही हैं और आपने इतने सहज भाव से लेकिन गहरी और गहन बातें की है कि हम सब थोड़े विचलित हैं. I'll try and take better control of myself, but very well narrated, really. Can I ask you a hypothetical question? मैं आपको एक speculative सवाल पूछ सकता हूँ?
जी डॉक्टर.
अगर हम ये सोचें कि आपकी पर्सनालिटी या आदत या हालात नहीं होते दोस्तों से और परिवार से शेयर कर पाने के, तो आपको क्या लगता है क्या होता? How would you have managed if you did not have the luxury and the benefit of family and friends to share your distress with? I hope I'm making myself clear. थोड़ा इमेजिन करके देखें कि क्या होता अगर ये नहीं अवेलेबल होता.
बहुत डिफिकल्ट है इमेजिन करना डॉक्टर, बट इस सिचुएशन में कई बार मैंने ऐसा किया कि मैं सीधा स्काई के नीचे बैठ करके चुपचाप शांति से 10 मिनट, आधा घंटा, जो भी टाइम मिलता था, I used to sit just beneath the sky, letting loose of myself, probably just trying to be one with nature.
मैं समझ रहा हूँ. That's wonderful. मुझे ये विचार आ रहा है और मैं आपकी प्रतिक्रिया चाहूंगा, अगर आप प्लीज करें. क्या आपके तजुर्बे से और आप और हम जो बात कर रहे हैं उससे हम ये समझें कि कोई भी मुश्किल दौर हो, समय हो, खासकर अभी जिस पे वो ऐसी गुजर रही हो, वो इन 3-4 में से कोई भी चीज कर सकता है. या तो दोस्तों से, परिवार वालों से शेयर करे, या जैसे आपने कहा फेथ इन गॉड, भगवान पे, ईश्वर पे, यीशु पे विश्वास हो, या अपने आप को अंदर ढूंढे, टू सर्च विद इन वन सेल्फ एंड फाइंड द स्ट्रेंथ. क्या मैं सही समझ रहा हूँ आपके?
जी डॉक्टर,
है ना? So for the general group of participants that we all have, I would crystallize one lesson as that when the chips are down, one has to find strength. It may be by any one or more of these means. One may do it by faith in God and religion. One may do it by finding inner strength. One may do it by talking to family and friends. दूसरा जो आपने रेणुका जी बात कही, मैं with all respect to whatever company it is, आपने वर्लपूल शब्द बड़ा मुनासिब इस्तेमाल किया, वर्लपूल ऑफ इमोशंस. लेकिन आपने जो बात कही सही है कि भावनाओं का, फीलिंग्स का वर्लपूल चला होगा. कुछ हद तक अगर मैं आपसे आइडेंटिफाई करूं, जो आपने बीच में बात कही, अगर मैं सही समझा कि क्या मेरे सारे प्रिकॉशंस लेना बेकार हो गया, मैं क्यों पॉजिटिव हो गई.
बिल्कुल.
आई हैव सेम फीलिंग्स, आई मस्ट से. जैसे मैं शुरू में कहा, 13 या 14 महीने अस्पताल में रोज काम करने के बाद, और मेरी ये बिलीव कि मेरा लाइफस्टाइल ठीक है, हेल्थ स्टेटस अच्छा है, मैं सारे प्रिकॉशंस ले रहा हूं. पहले 2 या 3 बार टेस्ट कराए थे, नेगेटिव हुए थे. सच कहूं, थोड़ी सी शायद गलतफहमी हो गई थी, हालांकि नहीं होनी चाहिए, और मैं अवॉइड करता हूं मेरे खुद के बारे में, क्योंकि मैं इतना हेल्दी हूं, हेल्दी रहता हूं, पॉजिटिव थॉट्स रखता हूं, प्रिकॉशन लेता हूं, मुझे पॉजिटिव स्टेटस नहीं हो सकता. लेकिन हुआ. तो उस हद तक मैं आपकी फीलिंग से भी आइडेंटिफाई करता हूं. मुझे लगता है हमारे बहुत सारे साथी इस बात को समझेंगे, क्योंकि जिनको पॉजिटिव रिपोर्ट आती है उनको, जैसे आपने कहा, पहली बात शॉक लगता है कि ऐसा कैसे हो सकता है ना. और फिर सारे राइट मैम, सही जगह, और फिर वो एप्रीहेंशन में बदल जाता है. थैंक यू सो मच रेणुका जी, तहे दिल से थैंक यू फॉर योर शेयरिंग. वेरी नाइस.
Over the past few months, we feel that there are two most important things which one needs to arm oneself. One is the accurate information, and the second is the calmness of mind to follow the safety measures and the protocols. But the irony is, the information about the pandemic and its protocol are available in fact, abundance. Not less, but in abundance, and making us very difficult to differentiate opinion from the accurate information. So keeping this in view, Scope along with Famhealth, we conceived this idea, and we thought of organizing this particular program so that we are able to impart with the correct knowledge and myths can be busted with the facts. And today, as Vishali mentioned, we have the privilege of having amongst us Dr. H.K. Chopra, one of the, whom I consider one of the best knowledge house and expert in the country in the field of COVID. Today, he will bring the accurate knowledge on the table and dispel many concerns that all of us may have. He will not only guide us on the medicines, but also how to follow healthy lifestyle through cautiousness and self-consciousness. Scope is thankful to Dr. Chopra for agreeing to address the webinar today and answer the many doubts that people have towards COVID.
It's really a great pleasure and honor indeed for me to be here on the platform of Scope and Famhealth on a very special occasion today. And the occasion is very well known to you. It is a 3M COVID protocol today and tomorrow, happening for the first time in the world, where we are integrating mind, fullness, meditation, and medication. At the outset, I express my gratitude and thanks to Madam Soma Mandal, Chairperson of Scope and SAIL, for her kind words, Mr. Atul Sopti, DG Scope, for his very nice introduction during the welcome address, Asha Kapoor, who is the MD of Famhealth, Mr. S.A. Khan and his team of Scope and the team of Famhealth, and all the members of PSUs and all the members of Famhealth, and each and every one of you for giving me this opportunity to interact on a very need-based topic and that is 3M protocol for COVID today and tomorrow. And what is the protocol? Why there is a need of the protocol? The answer is everybody should know what are the signs and symptoms we just learned. Everybody should know what are the diagnostic methods, and everybody should know how to classify these patients and then adopt and adapt it to the lifestyle and the medication. Medication should not be taken by self. Protocol and guidelines should be followed so that we can reduce the morbidity and mortality. If we take self-medication, then the mortality is going to be very high because the virus is very, very virulent. And a very important information which I would like to give you here, that the symptomatology varies because the disease has got a spectrum of 14 days. First 7 days and the last 7 days. They're very different. And first 7 days, people have prodromal symptoms, which I mentioned to you. And the second 7 days, there is a real cytokine storm and a thrombin storm, which may make your life miserable. And anybody can become a victim of such a storm if sudden deaths have been noted. Every patient has to follow a protocol. Please don't go to any chemist shop and don't start self-medication.
Dr. Chopra, I must thank you for the detailed answer that you gave. And I think COVID has made us all realize how important it is for us to keep track of our bodies. So many, for the last so many years, doctors have been talking about this. I think COVID has just given it a push that unless you really take care of your health, take care of your diet, and are into it completely, you're not going to be able to get rid of this problem very soon. So quickly, if people learn, it's going to really work. Okay, we have Mr. Antim Kumar ready and waiting to ask his question. So please go ahead, Mr. Kumar.
Good afternoon, ma'am. Good afternoon, sir. First of all, thanks to Scope for organizing such a wonderful event. And I thanks to sir. Sir, I have one question. Actually, I am COVID recovered patient. I have symptoms, first symptoms on 23rd of April. Now I am suffering from skin rashes. Initially, it was red like chickenpox. Now it is normal skin rashes. So what is the reason and treatment of the same?
I think it's very important, as I mentioned to you, since it's a systemic inflammatory state, rash is part and parcel of it. You must see a doctor and should be given anti-inflammatory drugs. When you give anti-inflammatory drugs over a period of time, it will disappear. You need to do your CRP so that we have an idea as to what is the level of CRP, and based on that, the therapy can be discussed and rule out other causes of rash also. When the rash in post-COVID time does not mean 100% it is COVID related. You must see the specialist, and the specialist will decide is it COVID related or non-COVID related. It is known that those who are in the recovery phase of COVID, rash is one of the manifestations which has to be taken care of by the drugs advised by the specialist as anti-inflammatory drugs. It is very safe and you're not to worry much about it, and it will disappear. It won't stay for a long time.
Thank you, sir.
And the next follower we have is Mr. Shyam Sundar Sethi, who's the GM of Hindustan Copper. Sir, if you're standing by, please ask your question. Mr. Shyam Sundar Sethi, if you're online, please go ahead and ask your question.
Ma'am? Hello?
Yes, sir.
Am I audible? Yeah. Good morning, Dr. Chopra and whole Scope team. Actually, my question is, I am having anxiety resulting in very high heartbeat. Also, I am the blood pressure patient, and in the night, there is no sleep, hardly 1 and 2 hours sleeping. should I take some medicines for this? And heartbeat is around 130, 140.
Very important question you asked, sir. I mentioned many times that we should remember 7S. Number 1S is salt restriction. Number 2S is no saturated fat. And number 3S is we should be very, very careful about smoking. We should be very careful about stress. And we should be very careful about excessive sugar. And the last 7 is very important, adequate sleep. If you are missing something somewhere, excess or deficient, you are bound to get a problem. Your question is, you have anxiety. This is also a post-COVID syndrome. I had a young girl who called me yesterday, 31-year-old from Lajpat Nagar, and said, sir, I'm very anxious after recovery from COVID. I don't get sleep and I'm getting palpitations, same as what you spoke. So all these patients, we give a little beta blockers in the form of Concor, what we call bisoprolol tablet, to reduce the heart rate. Because our heart rate should never go beyond 85 or so. It may affect the heart adversely. And number 2, we should have adequate sleep. There is a brain and heart axis. It liberates chemicals in the body. If there is excessive liberation of catecholamines, epinephrine and norepinephrine, it will cause palpitation. And this happens when you don't have adequate sleep. So you must sleep adequately 6 to 8 hours. Now the question is how to get sleep. Some people, they take melatonin tablets. Some they take Alprex, very safe Alprex. If one takes Alprex, they're safe, no addiction. Take it for a short while, and then gradually you start your exercise protocol. This is all because of fear, anxiety, as I mentioned to you. Sure. If you do a mindfulness and meditation every day and take some tablets for a short period of time, it will really help you, and pulse and all will be all right. Still, if I request you, since you mentioned the word, you are hypertensive, you should go to your cardiologist, get your BP checked, get your ECG done, and get your echo also done to see whether there is any event rate on the heart or not. We should try to understand what is the cause of this and treat accordingly. So you must see your cardiologist and do not keep it to yourself high heart rate or high blood pressure or anxiousness or sleeplessness. It may have an adverse effect. You should see your doctor, and they are treatable and curable. Very simple.
Thank you, sir. Thank you very much.
Thank you for joining us. बहुत important सवाल है, and this after this I'm going to go back to callers. Is on vaccination. We have, with God's grace, a huge population of 1.3 billion people which need to get vaccinated over the next 4 months, 6 months, whatever it takes, as quickly as possible. But there is always a question and a fear of which vaccine to take. What is the different technology being adopted while Covishield is being administered, Covaxin is being administered? Also, we are hearing about something called the mRNA technology. What is that about? And in your advice, what should it be that people need to look out for when they're taking the vaccine?
I think it's a very, very important question, Rishabh. I firmly believe that there should be a mass vaccination program. You asked me a very good question, which vaccine is good? I say all vaccines are good. The only technology is different. For example, mRNA vaccine, like Pfizer vaccine or Moderna, or we use even Zydus in India is making mRNA vaccine, which is going to be launched very soon. Johnson & Johnson, which is single dose in the United States, is also a mRNA vaccine. mRNA vaccines are those where the vaccines are given to an individual, not made by the virus, but they stimulate our cells to produce spike-like proteins. So when they make spike-like protein, antibodies are produced. So whenever the COVID virus attacks the human host, it needs spikes. So that takes those spikes which are already on the cells in our body, where already antibodies are produced. So the cells or the virus activity is nullified. So that's the technology which they use. But here what we use is either a live attenuated virus or a dead attenuated virus. Mechanism is same. So far as the efficacy is concerned, it varies. They mention up to 90% is the mRNA, non-mRNA is 82, 83%. But for practical purposes, all the viruses, all the vaccines are excellent. No vaccine is worse than to have a vaccine. And you should follow the vaccine, whether we get single dose and then a double dose and then a booster dose. We don't have much data about the booster dose, but only one caution is there. If you are an elderly patient, say 80s or 90s or 70s, with comorbidity like angioplasty, stenting or bypass or a valve replacement, and if you are on blood thinners, please don't stop the blood thinners, because the tendency for clotting is reduced to almost 0.04%, but it's there. I saw a patient who had all kind of comorbidities. She received a second dose of injection and she had a slight clotting in the radial artery. So this is a precaution. All the elderly patients already on aspirin. I take aspirin every day. So why will not stop aspirin? Unfortunately, people stop aspirin and they stop antiplatelet drugs. So that's how they get clotting. Otherwise, they're very safe, very efficacious, and these are all available. And I'm sure my suggestion and appeal to the government of India through this platform of Scope and Famhealth is that we must import, export, manufacture vaccines, and vaccines. And everybody should be vaccinated, boy or girl, young or old, male or female, all should be vaccinated. By vaccines, we will produce a herd immunity. People who suffered and vaccine, when we make a herd immunity, we can eradicate the virus. That's the future. If you really want to ask me what is the game changer going to be, the game changer is going to be 3M. As I told you, mask, mindfulness, meditation, and mass vaccination. Vaccination is the need of the hour. Now don't ask me Covishield or Covaxin, both are good. Choice is yours, what you want to be. So I don't think there's any controversy about the vaccines. The only thing is about the lactating mother, and again on pregnant mother, they have to be a little careful. Those people who have a tendency for anaphylaxis or allergic reactions, they should take the help of a doctor.
So what I hear you say, Dr. Chopra, is कि vaccine लेना जरूरी है. कौन सा vaccine है उसका फर्क नहीं पड़ता, because there is a full medical team at the back end doing all the research and making sure it's available to you. So everybody who is thinking twice, please go out there, get yourself vaccinated, make sure that you've queued up and taken your appointment, etc. And now, in fact, there are lots of free camps that the government is doing. So hurry up and go out there.
And Dr. Chopra, I mean, it's always mesmerizing to listen to you. Any of your video, any program interaction with you, whenever I talk to you or listen to you, always my learning has enhanced multifold. And today's session was a riveting, great session. I have attended so many programs or listened to so many videos, but I can say that this is, I think many of us will agree, Somaji will also agree that this is one of the best sessions we would have ever attended or participated.
हेल्थ, फिटनेस और पोषण पर पाए बेस्ट डॉक्टर्स की राय सिर्फ famhealth.in पर, और हमारी YouTube पेज माय फैमहेल्थ पर सब्सक्राइब करना ना भूलें।